morning. My name is Heike Heyman. I'm with Ideas Business Coaching, working with informed entrepreneur, and today we are interviewing Sarah Damiani.
Thank you for having me.
Great to be with you today. Sarah, let's start by talking about what it is you do, what your business name, how long you've been in operation, that type of thing.
Sure. So my business is Complete Care Acupuncture and Wellness. Technically, the business has only been its own entity since the beginning of this year, 2016, but it's the product of my private practice and how it has evolved over the last 5 years. So I've been in practice as a licensed acupuncturist in Maryland since 2011. And over the course of the last 5 years, things have gotten busy. We're seeing a lot of patients. Patients are doing really well. And Complete Care Acupuncture and Wellness was born out of the fact that I was running a one-woman show for a few years, got too big for me, and so I brought on some employees and some staff to help with that. So now we have 3 licensed acupuncturists and a few part-time massage therapists all under one roof.
Okay, fantastic. So you've seen some challenges in this development of growing your business from one person to
Bigger.
4 plus a couple part-timers?
Mm-hmm. Yeah, so it has been challenging. I think I've been lucky in the sense that it's been hard to keep up with the pace of the growth. So my sort of philosophy as a business person has been to kind of stay out of the way of the natural evolution of the business in terms of the way the patients take it. So the patients tell me they need more services, they need better hours, they need more availability, and when I became, one person became too small to accommodate all that, I did my best to keep putting together what they needed, and the challenge was to kind of keep up with that, as costs rise, certainly trying to accommodate the added expense maybe sometimes before the income came behind it.
Right, that's always a challenge and
Oh yeah,
difficult thing to decide. Now, we had talked previously and you mentioned that you have had a completely different career before acupuncture.
I did.
Could you tell me a little bit about what you did prior and what made you make such a drastic career change?
Sure. So I started as a software engineer and mathematician, and I worked that career for almost 12 years. About 6 years into it, I decided to make a switch to acupuncture. I liked software engineering, I liked problem solving, didn't love necessarily the applications I was doing. They weren't really passionate for me. Didn't love working in an office 8 hours a day, never seeing the sun. Had back pain at the age of 25, which is way too young for that.
Right.
So I just needed more freedom. I didn't like that I was, basically expected or forced to work 8 hours a day if I only needed 5 hours to finish my work. And you're just sitting there kind of biding your time or looking for other things to do. So I just really needed freedom, and I also needed something that I was passionate about doing every day, as a long-term career. So I was always interested in natural health care. I started getting kind of more interested in alternative forms of healthcare and integrative health. Acupuncture is a natural sort of place to go if you're interested in that. And somewhat ironically, I found out that there was an acupuncture school on the same street as my current office. And I saw the school. I didn't know it was an acupuncture school. I saw the name, but I was a software engineer. It sounded like a software company to me.
Oh.
So I found out it was an acupuncture school, and I thought, okay, that's the only acupuncture school in Maryland. That seems strange. It's on the same street. I should probably check that out. So ended up going to the open house, loved everything I was hearing, signed up for the program, and made the switch. So that was back in 2009 that I started studying acupuncture, and then I kind of did both for a while to keep above water financially.
Right.
And really, I didn't quit fully my software job I was working at part-time until I was pretty well full-time in acupuncture. So I was working many, many hours for
Right.
where they overlapped. But it helped me make the transition.
Right, right. Did you come away with any business skills from your previous job that you were able to use, or was it really just software and no
That's a good
information
question.
about how to run a business or manage people?
Yeah, I don't think that my former job necessarily gave me those skills explicitly. I don't really know where they came from. I think part of it is just when you're doing something you really love and you throw your whole heart and soul into it, I think I just kind of naturally saw what needed to happen to make it work, because I had made this switch. I'd spent a ton of money on another education, on another degree. It had to work.
Right, right.
And when something has to work, there's no more motivational situation.
Right,
It's unparalleled motivator. If it has to, you'll find a way.
Yes.
So I think I just kind of cultivated those skills on my own, just by way of necessity.
Right, right. Now, a lot of people in your situation, though, would probably stick with the one-person office.
Mm-hmm.
What gave you the courage and the motivation to go beyond that?
Well, you're right. So there are plenty of practicing acupuncturists who work part-time, sometimes even very part-time, almost just like a hobby, or maybe just fun money. That was never the situation I was in. So I've always, wanted to make a living full-time, but also needed to.
Right.
I don't know which came first. So when I was working just one-woman show by myself, making a good living, but I changed my career, and then my husband wanted to change his. So that's only fair, and he's now pursuing his dream, and he went back to school, and he's in a PhD program. So left his job. And again, the unparalleled motivator of you have to.
Yeah, so you had to not only pursue acupuncture, but you had to go big with employees and
Yes.
an office, and understand you've already relocated once to accommodate more people, and you're maybe looking to do that again.
Yeah, so yes, needed to for the income, but also, again, going back to what I spoke about in terms of having the freedom. When you're a one-woman show and you're doing it all, if you need to take a day off, the whole thing shuts down.
Yes.
And that income's gone.
Yes.
So every day I'm not in the room with a patient, that's no income.
Right.
So that was its own form of, I don't feel free. So I really like the freedom of having some other income sources that aren't just, my butt in the chair.
Right.
And we grew pretty fast from my little one-person office. We moved to this location, which I love. And part of the reason I moved here was because there is more room here to expand further, which, cautious optimism. I just thought, okay, if I'm just watching the way things are going, I might need more room.
Right.
And signing a long-term lease, you don't want to be stuck, in a place too small if the business is saying it needs more room.
Right.
So there is a possibility to expand further if I need it. I'm not even a year into this lease, and I'm already kind of looking at going a little further out into the next suite. So we'll see.
And you've added you've added massage therapy to the offering. Are you looking to expand into other medical professions?
I'm not at this time, although I'm open to any future that this business is destined to have. Massage and acupuncture are really a nice sort of duality in terms of different modalities. So a lot of times I'm looking at a patient going, you need someone to really get in here and work these muscles, and it would be nice. They go, oh well, who do you know? So I thought, well, gee, it'd be nice to be like, okay, I have someone for you. I just want to accommodate what the patient's needs. So that's how massage was kind of born out. And if we decide we need something more, then I'll look to that in the future.
Fantastic.
Yeah.
Now, what would you recommend for a patient to consider when picking an acupuncturist?
That's a good question. Something that I found a challenge that I think I've settled on a good solution was how much of my one-on-one time I give to each client, each patient. So it's going to be different everywhere you go, but I would, when you're considering an acupuncturist, I would ask, how much time are you available for my appointment? Because it can range. Some practitioners see one patient an hour, some practitioners see 4 patients an hour, and that's okay for some people. I was seeing 2 patients an hour, so basically I had about 25 minutes face to face with each patient. I found that there were more patients for which that felt shortchanged than there were for which that felt sufficient. So I moved to 1 patient every 45 minutes, and that is a sweet spot for me. So I don't need to be in the room for 45 minutes with a patient who doesn't need me to be in there that long, but we do see complex cases. And in those cases, it's nice to have the time. I'm not rushing them. I don't feel rushed. I feel like I have the time to go into some depth with their treatment plan, go into some depth with my questions, and build a strategy that's going to work.
Okay. Are there particular indications that are more likely to have quick results with acupuncture, or that are more common with patients seeking acupuncture?
Yeah, probably the most common reason people seek acupuncture is for pain management. So pain responds really well to acupuncture, and I think the benefit over other therapies is that, especially therapies that include prescription drugs or over-the-counter drugs, but anytime you're masking the pain, you're risking further damage because you're not given that signal to stop moving that way, or stop doing that, or don't go so long. So with acupuncture, we can, without the use of those therapies that maybe are masking the signs that the body is giving, we can relieve the pain, help the person understand how they're generating it, and then move them to a place where they're in less pain without needing to rely on medications and things. So pain is definitely a good one. We deal with a lot of digestive disorders. A lot of people are finding out there's situations with gluten intolerance, which is a big one, not necessarily celiac, but certainly gluten intolerance where we can't really digest it well. Lots of digestive disorders respond really well to acupuncture. One thing I particularly like working with is emotional disorders, so depression, anxiety respond great. So even with adolescent kids, I treat a lot of high school age kids who, it's a hard time, and there's a lot of anxiety, and there can be depression depending on what's going on at home. There can be complexity there emotionally. And they do really well here, and they seem to really like it. So there's not a whole lot that's not under the umbrella of what acupuncture and Chinese medicine can treat. My main advice would be, don't wait until you've tried everything else, and it's a very advanced stage of disharmony. I mean, we do see that. We do a lot of last chance acupuncture, Inc. kind of stuff. But it's always better to not wait until it's that advanced. Start seeking treatment, even in conjunction with what you're doing with your doctor or your chiropractor, or whatever. We can work with whatever you're already doing to find better relief for you.
Right. Fantastic. So in your progression in your own business, have you received some really valuable advice about the business environment, or have you learned something that our audience might find interesting about running a business that maybe came about through trial and error?
Yeah, the thing that comes to mind for sure is, and maybe this is only for certain industries, but so with acupuncture, the idea is, okay, you graduate, you get your license, now you got to get some patients coming in the door. And it's a slow trickle at first. So I honestly don't remember who to credit this advice to. I think I got it in school somewhere, but someone said, okay, if you want to work 30 hours a week, if you want to work 30 patient hours a week, in the beginning, if you only have 2 or 3 patients, work your 30 hours. Be in your office, find work to do your marketing, build your website, write content, collaborate on case studies online with other practitioners. Just work it. Work your hours even if there's no, patients coming in. And I did that. When I opened my little office that was just me, I had a very cute little wooden sign made. I kept my office door open, and the sign said, "Come on in, ask me about acupuncture." and people were walking in and just going, oh yeah, what's this all about? Oh, the office is so nice, you know, and it seems like this would be a nice place for me to come. What do you treat? And I'm sitting in there writing content for my website. So I built a thriving full-time practice doing that. So I think that advice goes unheeded a lot. I've given that advice to a lot of people. I don't think anyone's ever taken me up on it. But because it's hard, it's like, well, I'm off, you know, I have the day off, I could do something.
Right.
You got to put those hours in.
Yes.
Got to do it.
Absolutely.
And it pays dividends. It's worth it.
Yes. And I would imagine you still putting in a lot of hours because you now have to run a business, not just see patients. You have to manage staff.
Yep. First one in, last one out.
Yes, absolutely. Well, I appreciate you taking the time to speak with us today, and we look forward to seeing you online.
Thank you so much.
Hopefully your patient load will continue to increase.
Oh, thank you. I appreciate it.
Good to see you, Sarah.
You too.